Hi, I'm Janice Schwartz, and I am a cancer navigator through Surgical Services in Albuquerque, New Mexico. I joined, my tour of duty began in January of this past year, and I joined a team of people who have been working on a cancer committee to meet the standards of the COC. And when I came, one of the things we hadn't met yet was the Standard 303, which was the survivorship care planning. So we've put together a survivorship care plan for 7 different disease-specific care plans, taking our top priorities of what our veterans are diagnosed with. Prostate being the #1 diagnoses that we have right now. So over 700 veterans at the Albuquerque VA have prostate cancer, and nobody was monitoring them consistently. And so along with that, we have colorectal, we have breast, melanoma, lung is developing right now, bladder, urinary, and the didactic portion of it was to incorporate things that our COC wants us to include in 2015. So we also included the distress tool, and that's what I presented in my poster. We designed a tool so veterans can come in, see their physician, and mandatorily have to be assessed. The physician cannot get out of CPRS without addressing it. Yes, the veteran has distress and would like to have help, and it will automatically send an e-consult to the appropriate area depending on what the outcome of their assessment was. If they don't want help, then that's their choice. We're not forcing them to have it, but it's a way for us to consistently provide care in a systematic format. So one of the other things that we built into it was the ability to track that data. So it's one thing to be able to say that you provide it, but another is to find out what the outcome of that data would be. So we have health factors built into that that allow us to find out the last visit, what the patient presented with, and what the outcome was. We can compare what their rating scores are of their distress level and what the outcomes of their care were, if they showed up for their appointment, if they kept their appointments, if they're due for their appointments and whatnot. So the tool is supposed to not only help the veteran to get care, but it's to provide a way for us to track to make sure that the care that we're providing is adequate. And right now, because it's a new tool, we don't really have enough data correlated to be able to show full outcomes. Several patients have already been assessed and put into the program, but we don't have that data yet to show if it's on the return visit, just how many of those veterans kept their appointments, if it was adequate services, or if we need to find additional services for them. But in the patient population that we have, most of the patients already have PTSD, and then now you're complicating it with a disease of cancer, which it brings about a whole different realm of situations depending on their age. Various things throughout their lifespan are being challenged, whether it's reproductivity, whether it's financial, whether it's spiritual, just facing death itself. So we've incorporated all the different behavioral health, pastoral care, social work, social services to help them. So it's a broad tool, and we're hoping that it will be able to bring in the patients that are being missed or lost when we're transitioning them back to their primary care providers.